Thank you very much, President. I move my motion 331, which is a motion relating to documents to do with the planning of a new hospital in Albury-Wodonga. The Albury-Wodonga Health is a cross-border service straddling the Murray River and serving the people of Wodonga, Albury and the surrounding districts of North East Victoria and Southern Riverina, New South Wales. It has an estimated population of more than 300,000 people. It is the only cross-border health service in this nation. It is a unique example of the interwoven nature of these communities where people cross the river for work, education, family and, most importantly, health services. Two states contribute to the costs, but the health campuses on both sides of the river sit under the management of the Victorian Government. It is also the biggest Victorian regional health service based on throughput and emergency presentations. The recently renegotiated intergovernmental agreement between the two states now extends until June 2035, about another 12 years or almost 3 terms of the Victorian Parliament. Demand on the service is through the roof. The hospital starts the day somewhere between 30 and 70 beds, short of what is needed for patients in intensive care, emergency and medical beds. Historical planning documents made it clear that neither the Albury nor the Wodonga hospitals were or are suitable for future health service delivery. The buildings and operating theatres are not fit for purpose. There are risks to patient safety. There is asbestos all the way through the Wodonga Hospital. Documents have also revealed the Albury Hospital is built on a highly reactive clay soil, prone to movement, and that one building has already moved 60 millimetres. So the decision of the Victorian and New South Wales governments to jointly spend $450 million on the Albury Hospital site to meet the current and future needs of these communities raised serious questions around how the two governments arrived at this point. When the two premiers came together in October 2022, the then Victorian Premier Dan Andrews claimed the new hospital would become a one-stop shop, an acute centre that would cut duplication and reduce the complications of spreading resources across two hospitals. This was the preferred outcome, a single-site hospital that could cater for current and future demand. For many who had been involved in the development of a 1,200-page master plan developed in 2021, almost a year prior, the surprise was that the investment was at the existing Albury Hospital. Most had expected it to be a greenfield site as recommended by the master plan, free from the pitfalls and challenges of turning an existing hospital into a construction zone for a decade. That mystery unravelled last year when some 2,000 pages of documents were obtained by the member for Benambra from the New South Wales Parliament. These highlighted some questionable behaviour in arriving at the decision to build on the Albury site. These documents suggest that New South Wales and senior management at Albury-Wodonga Health had absolutely no intention of building the border's much-needed new hospital on anything but the Albury campus. And all of that despite its well-documented limitations, its history of unstable ground and the greenfield build recommendation in the December 2021 master plan. What is also apparent from those documents was that no one was telling any of the stakeholders involved in the development of the master plan that the deal was done, that a brownfield build at Albury was locked in. Yet another documents motion in the New South Wales Legislative Council has revealed that the Albury-Wodonga Health no longer believe it can consolidate its acute services on a single site with the funding that has been committed. That document was discovered last week, about the same time a new 130-page master plan with 700 pages of appendices selling the merits of a 10-storey tower at Albury was dumped on the community less than 24 hours before a community meeting that was trying to turn back the tide on the Albury plan. Despite all this paperwork, there is no certainty over the project, and New South Wales Health have admitted in budget estimates that they are still costing the final design and have not settled on a final costing. To fully understand the status of this project, the Albury-Wodonga community need to be fully informed, and that is why I'm seeking these documents today. This is a simple motion that calls for the release of documents. It is a narrow motion that makes a request for a series of documents relating to a project. These documents that the Legislative Council has the right to request, and the Minister should release them. These are documents that the Legislative Council has the right to request, and the Minister should release them. I urge members to support this motion.